It is a huge honor for me to be podcast interviewing my Kansas homie, my UMKC homie, Matthew Standridge from Eureka, Kansas. And I'm feeling so old today because you were born in Eureka, Kansas in 1984, and I went there probably in 1962. So I was hanging out in your town 20 years before you were born. I was just standing around waiting for you to be born. So Dr. Standridge is a general dentist in rural Kansas. He graduated from UMKC School of Dentistry in 2010. Out of school, he worked in both public health clinics, FQHC, and private associates. In 2012, he started his own practice back in his hometown of Eureka, which at that time had no dentist. How cool is that? In February of 2015, he bought a second office from a retiring doctor in the next town over, Yates Center, about 30 miles away. And there's almost no mergers and acquisition activity in dentistry, and everyone who does it just makes bank. He has spent copious amounts of time learning and implementing advanced services such as orthodontics, implants, splint therapy, sedation, and more. Dr. Standridge is on track to receive his fellowship through the Academy of General Dentistry in July 2016. Congratulations on that. Dr. Standridge is married to his beautiful wife, Sara, and they have a wonderful infant daughter, Hazel, who's not quite as attractive and beautiful as my only granddaughter, Taylor Marie. I did not write that. He did. Dr. Standridge's hobbies include, and by the way, she comes over to spend the night with Grandpa at 6:30 tonight. I'm so excited.
There you
Dr.
go.
Standridge's hobbies include reading and adding to his personal library, attending theater productions with his wife, and health and fitness. Dr. Standridge is currently undergoing self-experimentation with a primal ketogenic lifestyle to lose weight and improve his health, fitness, and quality of life. So how old's your daughter now?
She'll be turning 1 later this month. She's 11 months old, and she'll turn 1 on the 26th.
That is awesome. I feel sorry for my granddaughter because she's got 4 uncles and a grandpa, so I'm not sure. I don't think we've done any girl activities with her in her first 4 years. She thinks camping and hunting and shooting a shotgun is normal behavior. So,
hey, there's nothing wrong with that.
So I don't know how she's going to turn out. There might be. I think her 4 uncles are going to ruin her. But in a nutshell, 2/3 of the dentists graduate and go to the 117 large metros that have 2/3 of the dentist, and the other 1/3 go to where the other half of America lives, in the 19,022 towns. Congratulations on going back to rural. Kansas City, you went to UMKC Dental School. What % of your class wanted to stay in Kansas City because of the Royals and the football and the Chiefs and the Plaza?
Mm-hmm. Yeah, it's a kick-ass town, so I can understand. But yeah, there's a large percentage. I would probably say, I don't know if as much as maybe a third is what I would guess.
Yeah.
And if that's typical every year, that means every year a quarter to a third of the graduating classes.
Well, you've been out. This is 2016, so you've been out 6 years. So
yeah.
There's a ton of dental students that listen to this podcast. I mean, I think 20% of the viewers are in dental school, and I Skype into their classes all the time and give them a lecture and all that stuff. So tell these kids, do you think you had an advantage going to rural in a town with no dentist than your homie classmates that went to stayed in Kansas City where there's a dentist on every corner?
Oh, absolutely. Yeah. I mean, you just put the word out about a month before you open, and you're going to have definitely. When I started, I was still working public health full time, so I was here. I was working 410s up there, and I was down here. So I was down here Mondays and Saturdays. So I was only available two days, but the schedule fills up quick, and then as you're making money, you're at capacity, you add more and more days. So yeah, absolutely. It wasn't hard to get busy.
And how many people live in Eureka?
Oh, it's a real small town. City population is about only 2,800, so 2,800. And the county population is closer to 7,000. But when I opened, I was the only dentist here. That's changed, but when I opened, I was the only dentist in the county of about 7,000.
And how far away? What's the closest big town?
Wichita. It's
How
about
far
an hour away.
So wouldn't you rather live and raise your family in rural and make bank, and then when you want to go to the big city, you can drive in your brand new truck and just drive there because
Oh,
you're.
absolutely. Yeah, 100%. Like, it's Wichita's only an hour away. Kansas City's 2.5 hours away. Lawrence, Topeka, hour and a half away. So we can get away for whatever. And the day-to-day stuff, I like having a 5-minute commute to work and low cost of living. And you know your neighbors. You can trust your kids to play next door.
And,
So
and
yeah, it's a great trade-off.
and it's amazingly low cost because what's an average retail job in Eureka, Kansas compared to Kansas City? I mean,
Oh, retail job, like if you're just working at like a Walmart or a grocery
did you
store
have
or
a
something?
Walmart in Eureka?
No, we don't. I
Man,
would love one.
you know you're a small town where there's not even a
When you don't even
Walmart
have a
there.
Walmart,
So
exactly.
what's the biggest employer in Eureka?
Oh, let's see. It was the oil rigs. We have consolidated oil around here, but in the last couple of years, that's kind of really took a hit. We have a county hospital. That's a big employer.
But what
Um,
about like restaurant or chains, franchises?
well, that's the thing. There's no real franchises or chains except for Sonic. Luckily,
Hey. That's where I learned
yeah,
my eating habits.
yeah. So we do have a Sonic. They probably employ probably about 20 people or so.
And what would they pay? What would the average person at Sonic be making?
Oh, if you were a car hop starting off, probably around 850. If you're closer to a manager, maybe 13, 14, upwards to
But
16.
but the point I'm making is that wages is about 53. Money when you buy something for $1 that's publicly traded, about 53 cents goes to a human being,
Mhm.
and labor, labor should be 22, 24%, including everything, FICA matching, health insurance, 401k, CE, uniforms, everything. And
Yep.
in these big cities, you see that creeping up to 28, 30, 32. I mean,
hmm
40. I mean, it's tough. So, and then your rent, your building. Do you rent or did you build something?
No, I bought the office. The office I'm in, it was a dental office. It's just been sitting vacant for however many years. But it was a three-op dental office standalone building. So I bought it. It went back to the bank. The previous dentist had just left it. And so I basically bought it off the bank for basically what was on their records for. Bought the building, all the contents, everything, just for a flat fee, and got started.
Now in Wall Street, they talk every day about all the mergers and acquisition
Mhm.
activity. There's a lot of people who predict stock market futures, ebbs and flows, ups and downs based on M&A activity. And it's the dentists who do M&A activity, mergers and acquisitions, and buy a retiring dentist up the street. They just do phenomenally well. Some of the
Mhm.
biggest practices I've ever seen in my life bought every retiring dentist over their 20, 30, 40-year history. It
Yeah.
was huge. You did that at a very young age. How were you smart enough to do that, and are you glad you did it? Talk about that.
Well, I like to be real close colleagues with everybody around me, and so I knew the retiring doctor. I'd known him for a couple years, and him and our wives, we've gone out to eat and stuff like that. So became real pretty good friends with him, and then he basically decided that he was going to either retire, and he had a really fair price in mind for selling the office, selling the building with it, and all that stuff. And so he just came to me and asked, and I was kind of sitting on it. We hadn't started talking numbers yet, and I was like, but it made sense to me. And granted, it's in the next town over, which is 30 miles. About here in rural Kansas, to get to another place, it takes about 30 miles. But so we just started talking. He finally popped out the number, and it was fair enough. I was like, I couldn't pass it up. So now I'm very glad I did it, and I'm glad that the town and that county again still has a dentist. It's the only dentist office in the county over there, and so I'm glad that we're still providing services over there. What's What's the hang up now is basically capacity. My time is where we're bottlenecked. Between the two offices, I do have an associate over there who works Mondays and Fridays, and I'm over there on Thursdays, so the office is open 3 days a week. And my office here in Eureka is open 3 to 4 days a week. So really now it's capacity of provider time. If I could find a full-time associate or find a full-time associate and maybe eventual partner that shares the same goals and ideas that I have, I would much like to keep both offices at separate offices or separate locations, but merge the actual business together. And so we can set up like a VPN network between the two to have shared records and, rebrand everything, because right now they're two separate offices. Rebrand everything under an umbrella of a single entity and share records and have communication between the two. So that's what I'd like to do. If that happens, I'm not sure, but I might have to sell an office, sell the office to a new graduate. That's also a possibility. So it's just kind of up in the air, but it's exciting. It's a good time.
Well, you just need to spend more time working on your business than working in your business. And if you're just in there making hamburgers, fries, and Cokes all day, every day, then you die with one restaurant. And if you only work on the business, you're Ray Kroc and you die with 20,000 restaurants. So
yeah, and that's where this year we started in May with one of your favorites, I'm sure, Sandy Purdue and Classic Practice. Got signed up with them, started 1st of May, and so that's my real goal for this next year, this next 12 months, is really getting the systems in place, getting the trainings in place, so that way, if we do grow, it's controlled, it's smooth, it's not chaotic, and
I am absolutely shocked that dental software companies, whether it be EagleSoft's Dentrix or Patterson's EagleSoft or Henry Schein's Dentrix, or the people don't hook up with these amazing dental consultants and say, we're going to have a version for yours. Because one of the biggest problems with management information software is it's, when you check in at Hertz Rent-A-Car, there's just 3 steps to check in, 3 or 4 to check out. Same thing with the Hilton, the Hyatt. But what dental software has done is everybody's idea that was ever submitted to them, except for mine, hooking up to an accounting package, they've added the feature. So when you have a receptionist, they log on to these dental software deals. There's 48 million things to do. And if you go into any dental office and run reports, nobody uses 80% of the software. But that 80% keeps the confusion so high that they're paralyzed. I would hook up with Sandy Purdue in a minute if I was EagleSoft and say, just check off all the features you don't want, and they don't have to unprogram anything, and automate everything she does.
yeah,
And it would just be it'd be genius marketing. It'd be target niche marketing. It would be that's just one of the hardest things. That's why practice management is so huge in dentistry, is because they don't have they have third-rate management information systems.
yeah.
They're overloaded. There's no accounting. So in rural, and first of all, you can get an associate all day long. I mean, the United States military has 5,000 dentists working for them, and all the way to Afghanistan, Iraq. Who would be a dentist in Iraq or in an aircraft carrier or in North Korea and not in Eureka, Kansas?
Yeah, I'm telling you, and I was just up. At Kansas City, the KDA during the Midwest Dental Conference that they have up there. The KDA puts on a little meet and greet for graduating students or people who are going to be entering their 4th year and stuff. And so that's led to some contacts there. So hopefully. Have some people come out and check things out and everything. So hopefully something comes to fruition from that.
And you could also have you placed an ad in the classifieds on Dentaltown?
I have, yeah. Sure
and there's also the mentor program. You could sign up to be a mentor. That was a feature I didn't really know if that would be a good feature. That exploded. Have you seen the mentor program?
Yeah, I have. Yeah, I had applied a while back, and then I hadn't heard anything. And to be honest, I might have gotten received information. I was actually, when I replied, I was applying as a mentee,
Right.
and so I don't know. I never heard back from that or not. But yeah, I think that's a great idea. Absolutely fantastic.
Well, you should be able to be a mentor to someone younger and a mentee to someone older.
That's my goal. Yeah.
Is that an option on the program?
Not that I know of. I only
shoot me an email on your status on that to howard@dentaltown.com. Then I'll
okay.
reply to you and the team, because everybody on earth should be a mentor to someone younger. I mean, when you were in the first grade, you were a mentor to your sister in kindergarten, telling her what it was going to be like in the first grade, while you were listening to your two older sisters in the second and third grade. Wanting to know which nuns to avoid. And so, where did you go to school?
I went to school here. I was actually born in Wichita, but we moved out here when I was about 4 or 5, so this was home. And yeah, kindergarten through elementary, through junior high, high school, all the way here in Eureka. And then I went to Wichita State for my undergrad.
So you're a shocker.
Mm-hmm.
So another thing that you did brilliant is you hit the floor running with continuing education right out of the gate.
Mm-hmm.
To talk about that, what made you do that? What gave you such a appetite for continuing education, and what has been go in the order of what you'd recommend the most, and the second, the third, and the fourth?
Oh, absolutely. Dental Town. I discovered that when I was about, I think, in my 3rd year of dental school. And so I started plowing through. I really started plowing through a lot of the online stuff in my 4th year. 3rd year, I started lurking on the threads and all that stuff. 4th year, I started getting through the online, and it was when I was starting in. Right out of school, I was living in St. Louis and working about an hour south of St. Louis in public health, and I got your Virtues of Profitable Dentistry course. Really plowed through that. Again, doing a lot of online stuff. It wasn't until I moved back to Kansas that I started really going to a lot of location CE. The first thing that I went to was Mike Melker's Nuts and Bolts, and it was his first. I think it was his first workshop after he moved out to New Hampshire, because he was up in Washington, and they just moved out to New Hampshire. And I think is either the first or second workshop he had up there. So that was the first thing. And the very next weekend after that, I went and saw Rick DePaul for Power Procs up in Chicago. And then it just kind of snowballed, and I got all my CE ideas from Dental Town. Went and saw Jason Smithson, because I saw his just friggin' fantastic, awesome work on Dental Town, and then was reading Nosty's stuff, and that got me to take their Clinical Mastery's Ultimate Occlusion, and it was just a snowball, one thing after the other.
So that's so let's talk about ortho. So you took Rick DePaul's Power Procs.
Mm-hmm. That was my gateway drug, as he calls it, into ortho, and then a comprehensive. I found Big Bob Garrity's curriculum down in Tulsa, which is only a 2-hour drive from me. So that was fantastic, because each year is an hour, is 100 hours.
You need to take that call? Is that your wife?
No, it's fine. I found Garrity's, and they have a really good comprehensive straight wire curriculum.
What's his course called?
Well, it's the Garrity Orthodontics. Their website is orthodonticteaching.com. Tell them I sent you, and so I can continue as a monitor for free. I want to go back there for my 3rd year this fall.
So going to the specific, you said Rick DePaul Power Procs is short-term ortho. How long? Yep. How much money and how long was that course?
Oh, it was a weekend course. He had an at-home like DVD set for like it was like $700, and I started with that, just learning the theory of ortho, because as you know, in dental school you don't learn jack about ortho as far as actually applying ortho. So I got his at home and was just studying it. I hadn't worked on any patients yet, but just studying it. So then when I went to his course, it was just I was ready after I got done with his actual course with him and his wife and everything. I was just ready to hit the ground running when he came back. And so that was about what, 2,500 for the weekend? Maybe not even that. Maybe closer to two or less.
So you hit the ground running with short-term ortho or full band ortho?
Short term, yeah.
And explain to the viewers what you mean by that, short-term ortho, and what you learned at Rick Power Procs.
So the Power Procs or 6 Month Smiles or any of the STO things, they're more concerned about the anterior aesthetics. You're not distalizing teeth. You're not taking teeth out. You're not doing huge adjustments to the occlusion. It's just like, hey, instead of slapping on veneers to get these teeth straight, let's do some minor corrections to get better alignment in the anterior 6 and the anterior 8. So that's where the focus is at. Yeah, like I said, you're not doing a whole lot of occlusal. You're not shifting from severe class 2 to class 1s, or you can do some of that stuff, but I don't. If I'm correcting a class of a bite, I'm going to do more comprehensive.
But this is what grinds my gears, and I say that as the owner of Ortho Town, is that you went to a state school. Mm-hmm. And the taxpayers of the state of Kansas paid for a chunk of your tuition. Your tuition did not pay for even half of that dental school. And then you go back to serve a community of taxpayers, and does your town have an endodontist?
No.
Did you learn endo?
Yes.
Does your town have an oral surgeon?
No.
Did you learn oral surgery?
Yes.
Does your town have a pediatric dentist?
No.
Did you learn how to do pulpotomies and crumb crowns?
Sure did.
So everything is covered except the orthodontist.
Yeah.
So now we have a dental student graduate, goes to Eureka, Kansas, no ortho training, mm-hmm. and has to do these supplemental things. And the orthodontists do that because it's basically money's the answer, what's the question? And it's just not right. I mean, it's just absolutely not right. I mean, I mean, I think it's over the top. I mean, any specialist in town will help you learn anything. I mean, I can go to 3 oral surgeons, 3 endodontists, mm-hmm. 3 everything, but not orthodontists.
Yeah.
And I think it's wrong because the bottom line is the customer comes first. The patient mm-hmm. comes first. Look at your mm-hmm. remote control. It's batshit crazy with the 100 buttons. Because mm-hmm. when they go to design their remote control, everybody from TV, cable, DVD, everybody's trying to get their buttons in. So the customer's like, what the hell? Whereas Apple says and Google says the customer's first. I don't care what your DVD department wants. We're going to make this so that, an 80-year-old grandpa who's pre-dementia can figure out his damn... How many times have you been into a house where someone didn't know how the remote control worked?
Oh, yeah. Well, when I go to my parents' house on the weekends, Yeah.
So
my dad just turned 75, so yeah, no, and I do like that model because they're like, no, this is the hardware. You get to retrofit your machines to fit this more consumer-friendly product.
I know, and that's the remote. But the bottom line is, the patient comes first, and the rural citizens of America who pay half the country's taxes should have access to healthcare providers that are trained in everything. Because when you say, well, if you want this done, you got to drive an hour and a half to the big city. A lot of consumers won't.
Yeah, and that's why that's the exact reason that I started learning more comprehensive ortho, because I was seeing, short term, the Power Procs got my eyes open to orthodontic issues, and malocclusions and all that stuff. And so I would see these, and I started diagnosing ortho a lot more. But like you said, if you send them, hour and a half away, and that's for every 3 or 4 weeks for 2 or 3 years that they're going to have to do that. And they would ask, well, do you do braces? I'm like, no, I don't. I don't do that. And they're like, oh. And they'll look into it, and they're like, and I see them 6 months, a year later, and nothing's been done. She's like, yeah. The parents are like, I'm not going to make them miss that much school. I can't take that much time off work to take them. And so it just wasn't getting done. And so
why don't you write up? You should write this up as a complaint and send it to UMKC. You should send it to the dean. We should print it in Dental Town. I mean, it's just not right.
If you want me to write something up, I certainly will, because I don't know how good footing I am, but going back there anyway, so.
And there's a great orthodontist in Wichita, John Hollings. You should, John Hollings?
No, I haven't met John. I'll write that down.
Yeah, John Hollings. It's spelled wrong. It's Jon. His mother must have forgot the H. He actually grew up down the street from me. And,
really?
Yeah, he was like down the block in Hidden Lakes, and just a great guy. He's one of the greatest orthodontists I know. And we were classmates at UMKC in '87, but so then you went to orthodonticteachings.com and saw Bob Garrity, and so that was more an extension of what you learned from. So Rick DePaul was the gateway drug, and then you went to Bob Garrity. So how much was that, and how long was that? How many weekends was that? Talk about that for a while.
Oh, Bob Garrity's course is awesome. Now, unfortunately, Dr. Garrity, he's a little bit older, and his health isn't as good. Luckily, he still pops in and says hi once in a while, so it's great to meet him, because around the orthodontic community, he's a legend. But he has a disciple, Dr. Joe Schmidbauer, and Dr. Garrity's wife, Kay, who was his assistant and office manager for decades, who she knows as much as an orthodontist. Kay's knowledge is just off the charts with orthodontics. And so they put on, it usually starts in September. It's a 5-weekend. It's Friday, Saturday, an optional Sunday, but Sundays are very valuable, because from 8 to noon we share cases. Students bring in and present what they're doing, or ask questions on cases and stuff. So Sunday's very valuable. So it's Friday, Saturday, Sunday for 5 weekends, and it's 100 credit hours, and it's about it's less than $5,000. You're right around the $5,000 mark.
So right around one case. If you take that course and you did one ortho case, you'd break even.
Yep, it's fantastic. I can't recommend it highly enough.
And so then, Garrett, so he's in Broken Arrow, Oklahoma.
Yeah. That's where they're practiced. The course is in Tulsa. And so really easy to get to.
Where's Broken Arrow? Is that a suburb of Tulsa?
I think so, yeah.
So then, so you started with orthodontics, and then you went into Michael Melker's nuts and bolts occlusion. So even more occlusion. So what did that do for you? Why did you take that? And would you recommend that? And talk about that course.
Oh, absolutely. Mike is such a great guy to learn from. And what was cool about that was you're learning, like, they teach you occlusion in dental school, but like how to manage day-to-day stuff that you come across. It's pretty lacking. They teach you the textbook, but the real-world application is a little bit lacking. And so he taught us kind of real-world occlusion. He taught us how to fabricate anterior disclusion splints, so like in-office versions of dual arch NTIs type things, and the reason and the theory behind that. And one big thing that I really like is his emphasis on communication. And basically it's kind of based in a process of motivational interviewing, if you ever heard about that or study that. But that's kind of where his workshop led to, and yeah, I'd absolutely recommend it.
And what was that? Was that a one weekend course or a series
Oh,
of
that
courses?
weekend's hardcore. You are, I can't remember. It's been so long if it was 2 days or 2.5 days. But I mean, you're starting at 8 in the morning. You might not get out of there at eight in the evening. I mean, it is packed.
And where did you take that at?
Like I said, he had just moved out to Hanover, New Hampshire.
So you flew all the way up there?
Yeah.
Damn, you're dedicated. So yeah, his website is michaelmelkers.com. Michael Melkers, Michael obviously Melkers, MELKERS.com. And you have 2,000 posts on Dental Town. I think he's got about 20,000 posts on Dental Town. He's a hardcore sharer. And then you went to Jason Smithson. So did you fly all the way to London to go see Jason?
No, I went to,
you go up to Chicago.
Yeah,
and
I
see
did.
him
I went to Cosmodent up there. Yeah. Great facility.
Talk about that. Buddy Mopper's facility up there in Cosmodent. Just the view of it's just crazy. That's the coolest view.
It is amazing.
And
it's ridiculous.
It's also the most live, hands-on review of geometry. Because when you're up there in those views, the tallest buildings don't look the tallest, and some of their shorter look taller. And when you first look out the window, I said, "Wait a minute, what's wrong?" And so Buddy Mopper explained to me geometry and optical illusions, and I was standing there mesmerized by what I was seeing with my own eyes.
Yeah. No, that was a great course. What I liked about that was I learned principles of composite, both posterior and anterior, with aesthetics that I really come to bail me out because here in Eureka, Kansas, not everybody can afford porcelain. And so if they can't afford a crown, if they can't afford ceramic veneers or whatever, if I can give them a composite restoration that I can feel good about, I like having that in my toolbox.
And what composite does Jason like?
Oh, well, they use it's the Cosmodent brand composite. I have it at the office. I can't even remember what it is. It comes in syringes mostly. It's like I can't remember. But anyways, it's a lot of their anterior stuff. They have a microfill, which is they're one of the few brands that they make that make a true microfill resin. And
where is he at in the United Kingdom?
It's not in a big city. He's fairly, as far as I remember, he's fairly rural, actually. I don't remember the town that he's in, but he's not in the city. Re-enamel, that was it. I had to look it up.
Okay.
Yeah, re-enamel. That's the stuff.
So what other continuing education on your journey did you like?
Oh, there's been so much. There's the ultimate occlusion, the clinical mastery. I've only done the level 1 of that, but that also opened my eyes to.
Name the 4 instructors there. John Nosty.
Yeah, John Nosty, Mike Smith. Those were the 2 that were there at that course that I went to. Jason Litsky wasn't there, but he's also there. I know, and Leanne Brady has joined up with them, and that's exciting. And I also know Eric Jones. I know he doesn't lecture with them all the time, but he is part of that team. And then a buddy of mine over in Wichita just joined their team, Eric Farmer. Don't know if you know Eric, but he just joined up with the clinical mastery folks. And
wow, that is very cool. So, any other courses worth mentioning?
One thing that's really been a benefit to me out here is I went to Doc's Education and did their oral sedation training. So I have a level 1 sedation permit here in Kansas. And and oral sedation for adults, so 13 and over, basically. And that was great. That was absolutely a great course. Very very in depth. When I took it, it was out in San Diego. But yeah, Dr. Feck, Tony Feck, you probably know him. He was kind of the headliner of the course, and also Leslie Fang, which was awesome to see him. He's a professor at Harvard. He teaches at Harvard, and I swore his name sounded familiar when I got back home, and I look at my oral medicine secrets books that I used to study for boards. Sure enough, he was one of the co-authors on it. So
Tony Feck?
Leslie Fang was.
Leslie Fang.
Yeah.
And we're in the news today when we're filming this podcast, and they just found out that Prince actually had died from fentanyl. That's what the
really?
toxicology report said. So in Kansas, you have to have a level 1 what? A level 1?
Yeah, it's a sedation permit.
A level 1 sedation permit. How many levels are there?
There's 3. Level 1 is oral conscious. Level 2 is basically IV conscious, and level 3 is more general. So you have to be an anesthesiologist to get a level 3.
And what are you doing? You're doing a level 1. You're doing oral sedation and nitrous oxide.
Yes.
And what is and what was that? Are you use it very often? Do you feel safe with that?
I feel great about it because I'm selective with my cases, and I do a pretty docs. One real nice thing about the docs company and their system is that you really do your checks and balances. You really take an in-depth medical record, and it's all about case selection. And I don't deeply sedate. If I ask them a question, I can get a coherent answer. And we focus so much on the patient experience and patient comfort anyway, that I don't rely on the sedation. I rely more on using a compounded topical, giving comfortable injections, giving a good ambiance and comfort. That's what the sedation part is just behavioral management. It's not trying to put folks out. So
I think what scares people is the irreversibility of a narcotic. Are you using narcotics when you do this?
Yeah, so it's usually depending on the situation. The night before, a loading dose of diazepam, and then an hour before their appointment, depending, it's either a dose of triazolam, Halcyon, or lorazepam. And but we're not given max doses whatsoever. I mean, it's 0.25 milligrams of triazolam, or it's 2 milligrams of lorazepam. You're dealing with very baseline doses, and so given more than that, yeah, it gets a little. I would be out of my comfort zone, but we're dealing with such small dosages that I'm just not too worried about it.
Yeah. So when you talk about compounded topical, explain that. My job is to try to guess the questions my homies are hearing when they're listening to this thing. What do you mean by compounded topical?
So most topicals, they're basically benzocaine is what they are. If you get them through a supply company and everything, you're getting about a 14%, I believe, solution of benzocaine. Whereas a compounded topical, it has more. The one that I use, take for example, is made from Taylor Drug out of Arkansas City, or Arkansas City, if you want to say it incorrectly. Arkansas City, Kansas. They have a compounding pharmacy down there, and they have a line of topical called Triplicane. And basically, it's a mixture of lidocaine, prilocaine, and tetracaine. So it doesn't have benzocaine. And what's nice about it is it's thicker and it's anhydrous, so it stays where you put it. It doesn't just mix with the saliva and start running all over. And I let it sit there for a while, and it's pretty profound topical.
And this is part of your give a great injection technique.
Yeah. So with the injection technique, I'll dry the mucosa, place the triplicane, and I let it sit there for at least 2 minutes. And then I use, it's similar to the wand. I use a machine called the Comfort Syringe I think it's by Dentsply. And it's a computer-controlled flow rate. What's nice about it over the wand was you don't have a foot pedal. It has a handpiece that the cartridge loads into your vial, your carpule of anesthetic loads into. You use standard needle hubs on top of it, so there's no real extra overhead or stock. And you set your flow rate and you go. And so, because the big two things that cause discomfort from an injection is the initial penetration through tissues, which the topical takes care of, and then B, it's the rate of the injection. If you go fast, you create this large bolus of volume, and it burns and it hurts. Whereas you can do it manually by just going slow, but doing this all day, every day, I just tearing up my wrist. So I got this machine that took the rate of the injection out of it for me. So all I have to do is sit there with a pin-style grip and just let it do its thing, and slowly advance as I go. And I hear every day, patients compliments on it. So.
And how much did that cost?
$1,800.
And you think that was worth the money?
Oh yeah. That has probably been one of the biggest practice builders that I've had. Anybody phobic, anybody that comes in and everything, it allows me to treat kids because you're not coming at them with this, stainless steel syringe, and they don't even know that they've gotten a shot. So I would if and when we expand, I'll probably get one for every operatory. Right now, I just have one that floats around, but.
And talk about your journey. What made you commit and decide to get your fellowship in the Academy of General Dentistry?
Well, I really have a lot of respect for the AGD, and the fellowship just made sense. When I learn something, I like tracks. I'm kind of a linear thinker in that way. I like to in the fellowship. In studying for that, it forces you to get out of your comfort zone. Like you need 500 credit hours. Well, you can't take all 500 credit hours in implants, or you can't take all 500 in ortho or endo. It forces you to broaden your horizons. And where I'm at, where I don't have a whole lot of specialists to refer to, or it's at least very inconvenient to send folks, I kind of like to go by the 80-20 rule. I want to be able to do about 75 to 80% of the cases that walk through my door, and be here for people. So the fellowship through the AGD just was totally in line with that.
Did you meet any friends, acquaintances, like-minded dentists like yourself by joining the AGD and earning your FAGD?
Not necessarily straight through the AGD itself, but a lot of the people that I respect, and a lot of the people that I've become close friends with through taking their courses, or or learning from them or learning with them, like a lot, you start to see a lot of the same people at these courses that we run into each other and we'll go out to dinner and stuff. And it's mainly the fact that everybody has similar goals in mind. It's not so much that you learn it from doing this one thing together. It just happens to be that you all are kind of doing this thing, and that camaraderie is what kind of brings them.
And and I've always seen that too. And the townies are always there. I mean, who are the people who, after a long day of work, I mean, probably 80% of them say, I want to have a beer, watch ESPN, and clock out. Who are these dentists who go log on to Dental Town and just keep learning and learning and learning till wee hours of the night? I mean, it's really the cream of the crop.
Yeah, absolutely. And it seems like you have two types of folks, and this isn't knocking on either camp necessarily, but I find that you have about a half to three quarters that, at least when I got out of dental school, they just kind of did enough continuing education to keep their license up, and that's about it. And then you have, at the far other end of the spectrum, you have that 25 to 30% that just went hardcore, started going to Dawson or Spear, or just started taking continuing education like crazy. And I haven't really seen a whole lot of in between. It's kind of like you either fall into one of these camps, and so.
Well, talk about that. So on your journey, and I try to ask questions that I'm receiving the most via email at howard@dentaltown.com. And these kids come out of school, they want to take all these things, but they can't take them all. And they're inundated with advertisements to learn from Pankey, Dawson, Spear, Coyce, LVI. Did you do any of those five?
No, because I couldn't afford the tuition and all the travel. What I did very first thing was buy Dawson's textbook. And I just read it. And it's so simply, it's a textbook, but it's simply written to where you can understand it. It's not filled with all a bunch of techno jargon that's meant for researchers.
See, that's what I say is street smart. Like, I didn't take Mish till first I got his book. Then I read his book, and then that made me think, well, I want to see the surgery. So I went to that, but I was amazed that it was 7 3-day weekends in Pittsburgh. And I was amazing at how many people in the class were lost or asking these questions. And I thought, my God, you could have read the book and known all this. And so you read Dawson's book. So you didn't really need to go down there and watch them do it. I want to ask you a specific question because I get this question all the time.
Okay.
Lots of kids want to learn more about occlusion or TMJ or TMD or craniomandibular dysfunction, whatever you want to call it. And there seems to be kind of two camps. One is kind of a CR from LD Pankey, Peter Dawson, Spear, John Coyce. And the other one's this kind of neuromuscular, which I think the biggest brand would be LVI.
LVI,
What camp would you say to learn first, or what are your thoughts on those? Do you think they're two different camps?
Well, no, I think there can be some overlap, and one of the biggest reasons I myself fall back into the CR camp. So folks just beginning, dental students, the centric relation, and that's where I base most of my stuff at. But the neuromuscular side of it, I think we can learn some things from deprogramming and possibly tensing muscles and everything. And so that's why I really like the ultimate occlusion through clinical mastery, is because it's based in CR, but they've also learned the neuromuscular side of things and can implement some of those technologies as well. So you kind of get the best of both worlds. In my opinion, you base your stuff in CR, but you can still quality check yourself using like a T-scan or or you can do healthy diagnosis of the joints through using a JVA. And those are bioresearch equipment by the brand Bioresearch if people want to look into that. But I don't think they have to be mutually exclusive. I just think the way that the camps have segregated themselves, it's become that way. But I don't think it needs to be.
Well, you know, just the nature of humans are just so tribal. I mean, look at
Yeah.
Kansas, the difference between KU and K State. I mean,
Yeah.
you know, and I'm out here in Arizona, you know, U of A versus ASU, and it's fun in
Yeah.
games when it's in football. It's
Hmm.
absolutely ugly when it's in warfare or
Yeah.
racism or what have you.
Hmm.
But yeah, it's funny to see all the tribalism in dentistry. You know, I mean, there's a lot of tribalism or camps, whatever. So what are your views now, 6 years out on CADCAM?
Oh, I would love CAD/CAM. I just with being limited to three operatories, I can't tie up a chair that long. I think with the event of Emacs, I think that's a wonderful material. Some of the companies are starting to come out with a zirconia, an in-house milled zirconia. I think that could be really exciting. So if to me, CAD/CAM is great. You have to make sure that you're doing the units because a lot of the salespeople, a lot of the reps will be like, oh, well, you only have to do 16 units and you'll pay for the machine. I'm like, well, if I'm only doing 12 units a month, then I probably shouldn't get it. Or if I don't have, if it only takes me an hour of chair time to prep a crown, and it's going to take me 2.5 hours of chair time of this patient sitting in the chair, and I only have three operatories. Um,
Ding 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 ding
yeah,
ding. You just nailed it. And if you told 100 people they needed a crown, what percent would the question say? Well, how much is it? What will it cost? Will my insurance pay? Or is it going to hurt? You going
98% of
yeah.
people
How,
would
how,
ask
how
this
many of those
question.
100 would their major concern be? Well, I just want it in the same appointment.
Well, out here, not many.
Yeah.
Yeah, I mean, I was the first place to offer digital X-rays or an intraoral camera, and that was a huge jump for out here. So
In
out here
Phoenix,
the
we
demand.
we just have an etch a sketch, and it's horrible because I've put
Let's
some of
do
the
like
greatest. I put up
those police drawings, those police witness drawings.
so then say I want your brilliant views lasers
Hmm. I don't have a hard tissue laser. I have a Picasso light,
from Alan
and
Miller Lasers,
yeah,
AMD Alan Miller
AMD.
Design. So
Hmm.
you have a Picasso. Why did you get a Picasso? How much did it cost? Are you
Oh
glad you
shoot!
bought it?
It was like I got it at Townie meeting for like 2 grand. Because they had a little special when they were there, and that was back in 2014. Um, when I went to there, and yeah, it just made total sense to do it. I don't really have the room or the budget for a hard tissue laser, and I'm not doing anything like Lanap surgery or anything. I'm just doing tongue ties and frenectomies and operculectomies and stuff, and maybe a little bit of gingival recontouring or crown lengthening for a crown once in a while. But I'm not doing anything real gnarly. So Picasso Light was a perfect fit, and the price is awesome.
And talk about the Townie meeting. Why did you go to the Townie meeting? What was the experience like? Would you do it again?
Oh, absolutely. My goal is to either this next year or the year after be able to take my team to the Townie meeting. I think that would be a good time for, not only training but camaraderie and everything. And basically, because I spent years on Dental Town and I'm getting to know these people online, and I'd like to see folks face to face, and
That's
as
the
the first.
coolest thing. You know, you go
Yeah.
to a lot of these major meetings, you might not know anybody, and you go to a Townie meeting, and you're big fans of
Hmm.
all these people you already met online. It's every year. This year is our 15th annual. It'll be
Wow.
April 19th and 22nd, 2017, in Las Vegas at Caesar's Palace, which is only 319 more days to go. If you and I'm reading that off the app or the website, go to towniemeeting.com. Um, what's your view now, sitting here years out of school, on surgical placement of implants or a cone beam or CBCT? Is that on your horizons?
I do implants. I'm still in my infancy. I learned through the Osteo Ready, so Brady Frank, Tony Feck is a core for that. Stephanie Mohan, their uh, company, and that's what got me into the place. I've been doing so much oral surgery, impacted extractions of impacted thirds, that placing a single root form implant to me didn't seem like it was a big to do, as long as you're doing your due diligence. And I don't have a cone beam. I have a practice about 45 miles away does have one, and so for if I'm iffy, or if there's any complications or whatever, I will send them there and get a scan there. But I don't do mine. I don't do my guided. I freehand. I use some tools that help out with that. That make it a lot easier to do. But yeah, I'm not doing. I don't have 3D and I don't have guided just yet.
And that was probably the most controversial column I ever wrote in my life,
Yeah.
because about surgical guides. I don't think I've ever done anything that generated that many emails to my inbox. But the bottom line is, it seems like all the surgeons my age to 75, 50 to 75, who have placed 1,000 to 30,000,
Mm-hmm.
they do them all freehand. And
Mm-hmm.
then the young kids, the Generation Nexters, the millennials, like these surgical guides.
Yep.
And it comes down to dentistry is an art. And
Mm-hmm.
I know that when you talk to a lot of oral surgeons, are like, okay, for single tooth placement, they're like, come on, you got a tooth in front of it, behind it, you got both
Yeah.
buccal walls, you drop it down the middle. I do see how surgical guides, there are a lot of errors when you're placing a 4 or 6 in an arch.
Yeah.
And
Absolutely.
so there's 100 ways, 100 shades of grade. You just seem so street smart. You read textbooks. You went to rural. You did a merger and acquisition. I seriously, dude. I know I'm a lot older than you, but you're a mentor to me.
Oh, thank
I'm
you,
a big
Howard. I
fan of
appreciate that.
your posts. I can't tell you how many times I've read some of your posts and just thought, damn, that's something to think about. That's smart. That's great. I mean, really, you're what I call an old soul. You're 31, but you think like a 60-year-old, a 70-year-old. I mean, really,
Oh, thank you.
huge
It's a great
fan of
honor.
yours. And now you went public with something that most people don't like to talk about, is with health and weight loss. What
Yeah.
made you want to come out of the closet and say, "Hey, I'm a big guy. I know it, and
Yeah.
it's a struggle," because so many people, I believe there's a lot more to this obesity that is not understood, because I just
Mm-hmm.
know so many really sharp, smart people who
Mm-hmm.
fight it all the time,
Mm-hmm.
and you see it running in families.
Yep.
Have you ever thought about this? We grew up in Kansas. What did all the farmers feed their cattle and pigs and chickens to make them
Yeah.
fatter?
Corn. Yeah.
Well,
It's all
well,
corn and grains.
and antibiotics.
Yeah.
And America is 5% of the population takes half the antibiotics in America. There's when you talk, first of all, I just want to start with this. When you talk to people with PhDs in obesity, they
Mm-hmm.
tell you that if anybody thinks they know what's going on or understanding it, that they're insane. I mean,
Mm-hmm.
we've eaten all these antibiotics. There's research showing that twins, one of the kid got antibiotics for an ear infection, the other one didn't. The one with the antibiotics is obese. We feed it to all of our cattle.
Yeah.
I mean, I got 5 sisters, and I mean, it's a huge issue.
Yeah.
I don't know what's going on, but talk about your journey on weight loss and health,
Okay. Well,
and
I've
why did you
always
go public with it?
well, to give a Cliff's Notes on the history, I grew up very, very obese. I was 200 pounds by like the 6th grade.
I mean, there's more. There's got to be a
Hmm.
genetic, or maybe antibiotic, or
Yeah.
your gut flora. Something is not understood in this journey.
you look at my dad, and he weighs 160 pounds dripping wet, and he ate the same foods that we did. He ate the same portions as we did, So yeah, the people who said it's all just gluttony and sloth, I'm just like, you don't know what you're talking about. I don't know how much I maxed because we didn't have a scale at home, so I used the scale that we used for wrestling, and it topped out at 320. And so I hit that mark. So I don't know how much above that I was. Then Atkins was making its comeback. It's that low carb kind of philosophy. And I picked up that book. I read it. It made a lot of sense to me. I applied it. And in 2 years, I was down to 195.
Holy moly. 2 years of Atkins took 100 pounds off.
Yeah, at least. Yeah.
So do you think your body just responds better of metabolizing protein than sugars and carbs?
Yeah, I got to stay away from the sugars and carbs, absolutely. And that's what I have to do. Does everybody have to do that? No. I think if everybody cut out refined sugars, I don't see the need for anything of refined sugars. If people get sugars from their vegetables and a little bit of fruit and stuff, I don't see the problem in that. But refined sugars, I don't see the need for any human to consume that. But then that's our job security, so who knows? But yeah, so I kept that off all the way through high school, through college. It wasn't until dental school that, with stress, lack of exercise, and then also professors at that time talking about the evils of low carb in our nutrition classes and stuff, I abandoned it. And sure enough, in that first year, I gained 60 pounds. In the next 3 years, I gained another 40 pounds. So I was back over 300 again.
But I remind people that that everybody's different. I mean, take the number one prescribed prescription in America for 2 decades. It's hydrocodone.
Yeah.
And it's actually a joke because if you gave it to 4 people, one would say, my God, I slept for 3 days. The other person says, my God, I was wired and bouncing off the ceiling and read 3 novels. The next person says, my God, I was constipated. I couldn't have sex or a bowel movement or all messed up. And then the fourth person says, oh, yeah, it worked for the pain. It's like we give a drug that 3 out of 4 people don't like. And now the research I've been following this Prince story, and all the news guys, everybody who's specialized in this, saying that opiums only work for short-term pain, and that after you take a narcotic for pain after a week or 10 days, it actually does the reverse and starts lowering your pain threshold. So Prince had a hip surgery, started taking pain pills, but he kept taking them. The longer he took them, the more pain he would be in. So then you're taking even more. And so I remember, so we're all different. We all probably need different diets. It's the same thing with my little brother. He was born when I was 17, and he was born Liberace. And when I hear these people telling me that homosexuality is a choice, they don't even know what they're talking about. No. I mean, I knew my brother was gay 10 years before all my friends used to know. I mean, my college buddies, they'd meet him for like 10 minutes, and they turn to me and say, okay, dude, your brother's gay, right? And it's like, yeah, I know. Thanks for the heads up. And then you have all these people saying, oh, he just chose that, or that heavy people just choose to eat. We don't know the appetite control. I see it with all the families I am. Some people just, their body's telling them to eat all the time. Yeah. And then you have friends. I got several friends where every once in a while they're not feeling very well and they're dizzy, and then they'll say something to me like, I think I forgot to eat. I don't think I've eaten for like a day. And I'm like, dude, how do you forget to eat? How do you forget to eat? Unflipping believable that some people forget to eat. And while others are like, no, you can't go in the kitchen and snack anymore. You have to stop or eat an apple or something like that. But I'm just so proud of you. I'm proud of movie stars that, getting double mastectomies or colon cancers or pancreatics, and out there saying, yeah, I'll share my journey with you. And you have been an open textbook on Dental Town, which means you're just high self-esteem, great guy, love you to death. We're everything in common except you're tall and handsome. We even both did wrestling. So what was your wrestling journal like? That's the only reason I'm a dentist, because My dad kept telling me to drop out of high school because he had 9 sons. He's like, I'll get you a Sonic franchise. School's a waste of time. And a lot of these franchisees that had hundreds of Sonics, their boys were all dropping out. And by the time I got to dental school, they were already millionaires with 7, 8, 9 restaurants. But for some stupid reason, I just kept wanting to be a dentist, and I still do. But the only reason I got good grades is because they kicked you off the wrestling team if you made a D.
There you go.
I did my homework. So did you like wrestling?
I did. I wasn't very good at it. I was much better at lineman at football. But yeah, I just wrestling to me, it was. I'm glad I did it. I didn't do it all 4 years or anything, but I'm glad I did it. It's a tough sport that really demands respect. But I was much more of a football guy.
Did you think the wrestling was a good off-season cross-training for linemen? I mean, did you learn anything in wrestling or takedowns or single legs that helped you
I think so.
knock some guy down?
And what I really like about the wrestling was, and I wish I would have kept it up, is a lot of the leg sweeps and all that stuff. It's forcing a big guy to work on their mobility and their functional strength, whereas football, you're in all of these, just what they teach you is just kind of linear patterns, and then at least that's the way it was in ours, and it's just like things out on the field ain't linear. You're moving in all sorts of directions, and you're turning your hips and your knees certain ways, and so it's good to be flexible in all planes of motion.
So poor Ryan sitting next to me, I made all my 4 boys wrestle year-round from age 5 to 15. I used to feel like a horrible father, Ryan, because sometimes I go there early in the morning to wake you up for wrestling, and you'd all beg me, no, we just want to sleep, please let us sleep. And all the other normal parents, just had their kids wrestle during wrestle season, but not stupid dad. This is a year-round psychosis. You still have memory scars from wrestling? Are you glad you did it, or are you? Well, hey, Matthew, love you to death. You're my favorite homie from Kansas. Thanks for all you do for dentistry. Thanks for 2,000 posts on Dental Town. Thanks for sharing everything about you. You're just an open mind, open book. What if someone wanted to contact you? What would be the best way?
Yeah,
email.
You can message me on Dental Town. I'm Mathematics. That's my handle on Dental Town.
What is it? Mathematics?
Yep.
M-A-D-A?
No, Mattetics. So Mathematics.
And is that a play on mathematics?
Yeah.
Mathematics?
And then, they can email me. My email is so first initial, Standridge, S-T-A-N-D as in dog, R-I-D-G-E, DDS, at yahoo.com. Or I have a lot of Dental Town homies I'm friends with, you included, on Facebook. So find me on Facebook, send me a friend request, or message me, maybe explaining who you are, and we can join up on there.
So your name is basically Stand on a Ridge. I wonder if you're
that's exactly how I tell people. It's just like Standridge, standing on a ridge.
But most last names come from an occupation. I wonder if your dad was a great-great-great-grandfather was a castle guard or standing on a ridge. I wonder if it was like how Ferran means baker, Smith means a blacksmith, for horseshoes. What is your name origination?
I don't know that. I know that we had a crest, and I used to have the crest. I don't know what the origins are. I know what my mother's maiden name was Scrivener, which is a play off of Scribner. So that's kind of self-explanatory of what that origination was. Scribe.
Our
Right.
family crest is bizarre. It's the Pillsbury Doughboy eating an Oreo, and that's strange that it came from Ireland. Hey, Matt, thanks so much for an hour on your only day off of the week. Love you to death.
Thanks, Howard.
Peace out. Have a good weekend, buddy.
Yeah, you too, bud.
Bye-bye.